NGOs and all of the NGOs to disseminate this information about the health insurance so that rich and poor get equally treated. Every citizen has the right, and insurance will people know it better. We are 100 people here. We donate rupees 10. Out of this, it comes 1,000. Poor people need rupees 100 for something. It is pooled towards that. So this is, in our terms, this is a charity. Do it. So wonderful concept. I feel this should go up and it should be encouraged.
Thank you, Doctor.
Thank you. Thank you so much, panelists. But I would just like to ask you any closing remarks you have on this topic, about the trends and whatever is coming, and how do you, sort of build a patient-centered environment for the healthcare industry?
Yeah, actually, the winding thing is that motivation doesn't work without action. So take responsibility and do action. If you, no matter what you want to help the society, just take initiatives and do it. Don't think a second thought. Thank you so much.
No, as we discussed, we have to stay healthy. As she was mentioning about how to stay healthy, have food habits, exercise and all. Otherwise, we will end up in dialysis. So it's something in the beginning only. When it is gone beyond, then you have to go to the doctor only. So it is all how we, because from the schooling we have to ensure, and also from our home, our children's or our co-working people and all, we have to give a healthy environment.
Thank you.
I think for me, the only thing is that technology is definitely playing a very big role, and a lot of people out there are able to help you, the healthcare professionals to improve their technology adoptions in a very big way. So please have an open mind for it, and try to utilize these tools, which will definitely help in growing the business. It's not only from a monetary perspective which I'm talking about. Most important thing is because the reach has to increase. It will not be possible with one senior experienced surgeon to be able to treat 10 lakh people. So that to be imparted to the larger audience, technology will play a very important role, and hence if the healthcare professionals use the consultants to be able to adopt it, it will make a very big difference in the overall improving of the market itself. Thank you.
Can I put a message through your media? Can it go to the government? Can I put a message? Can I put a remark? Do you allow me?
We'll try to have it
Yeah.
passed on, sir.
Yeah. If I put a message for the administration, for the government, for the officers in charge of the affairs, for the policymakers, the message is we have to improve the healthcare in the rural, the peripheral areas, because they constitutes our 60% of the population. They earn for us. They are our farmers. They are our laborers. Factories only don't provide everything. All the factories are in the metropolitan cities, but the actual person who gives us bread and butter lives in the village. We have to take care of his health. The scheme from the Prime Minister of India, the PMJY scheme, the Golden Card scheme, Sehat scheme, which is insurance related, should be continued and boosted, more funds allocated to it, so that the poor people who are getting benefited from it will continue to benefit. And private sector need to be encouraged, so that these poor people, because of this scheme, who can never think of going to the best infrastructure and get treated, will avail with pride, will feel proud and get the best health care in the private sector with the best infrastructure because of this scheme. And of course, to the common people, those who can afford should go for the health insurance. And again, the prevention is better than cure.
Thank you. Thank you so much. I would like to thank all our panelists for joining us here. Big round of applause for sharing in their invaluable insights. Thank you so much for joining us here. We'll just have one group picture. Ma'am, can we have you on stage? One group picture with our